welcome. Thank you for joining us for Obesity Care Week 2022. Now is the time to act. I'm Joe Nadglowski, Obesity Action Coalition President and CEO. For OCW 2022, we had the privilege of speaking with U.S. Senator Dr. Bill Cassidy and House of Representatives member Dr. Raul Ruiz on the Treat and Reduce Obesity Act. But before we get started, we would like to recognize all of our OCW 2022 supporters. We'd like to thank all the champion organizations for supporting us this week. And we'd like to thank all of the OCW 2022 partners, our bronze partner, Eli Lilly, our patron partner, Endopharma, and our supporting partners, Boehringer Ingelheim, Celebrate Nutritional Supplements, Curax Pharmaceuticals, Fujifilm, Intuitive Surgical, and Rhythm Pharmaceuticals. Thank you for all of you for your support of this important week, especially our partners and champions. Without your support, OCW would not be possible. For almost a decade, the Obesity Action Coalition and many organizations associated with Obesity Care Week have advocated for the Treat and Reduce Obesity Act. This important legislation, if passed, would provide Medicare recipients with access to obesity management services and much more. However, we've continued to struggle to pass this legislation, and obesity rates have only continued to rise nationwide. I'm excited to share with you two interviews with members of Congress who have tirelessly supported this legislation and share with you the importance and value of your voice in getting this passed. Up first, it's my privilege to introduce Senator Dr. Bill Cassidy. Dr. Cassidy was elected to the United States House of Representatives to represent Louisiana's 6th Congressional District in 2008, and in 2014, he was elected to the U.S. Senate. He sponsored the first House version of the Treat and Reduce Obesity Act in 2013 and has remained the lead Republican sponsor of TROA since joining the Senate. We've been trying for the past almost 10 years now to pass the Treat and Reduce Obesity Act. That's a long time, right? And you were actually helped us introduce that when you were on the House side in 2013 as the lead Republican. But it's almost been 10 years. So what advice do you have for our members who are getting a little impatient and kind of what's next when it comes to the Treat and Reduce Obesity Act?
Don't be discouraged. I was once told by an old hand that when you pass legislation, it's also often the confluence of politics, policy, and publicity. Tragically, COVID has given us publicity on the importance of obesity and therefore treating obesity. If you look at the people dying, disproportionately, they are heavier than they should be. So if we expand coverage with Medicare, and we can give the therapy and medications that will be important to fight obesity, we bring a solution to how do we address COVID. Now, you could argue many other things, hip replacements, for example, but this is something which is topical, if you will, the publicity portion of the policy and the politics. How to say this? We have to not manipulate public opinion, but capitalize upon awareness to make both my colleagues in the House and the Senate aware. But the best way to make them aware is to have folks who live in their districts or their states calling them, emailing them, contacting them. We need to do something, and this is one of the things we can do.
Thanks for that, Senator. I really appreciate it. And again, we know you're a longtime supporter of this, and your medical background obviously adds to your passion around this topic. Let's talk a little bit more about this COVID side, because I think this has been a change for us in this country, right? If you think about it, you know, it's always been down the road when we talk about COVID or we talk about obesity, we say, well, obesity is something that could hurt you tomorrow or 10 years down the road or 20 years down the road. But now with this combination of obesity and COVID, right, it really can harm you today. Do you think that that's impacted your colleagues on the Hill, or are they saying now, you know what, it is time to do things about conditions like obesity and the other chronic diseases that make COVID something worse for people living with their conditions?
So this is a little bit of a dance, if you will. Folks don't want to blame the victim. So on the one hand, now I'm a doc, so I'm just saying, I just spent my professional career. If there's something I can do to make you better, we're going to have an honest conversation. Which, by the way, I occasionally have with myself. I should be doing my stretches. I'm not doing my stretches, that sort of thing. So there is a laudable, okay, let's not blame the victim. So almost people don't want to go into those lifestyle things that could change, that would make someone less susceptible to the morbidity, mortality of COVID. I say that is a false compassion. Because if you can bring a tool, for example, the Treat and Obesity Act, if you can bring that tool to help people address their issues, that is true compassion. And that should be the reason why you should have the conversation. Because not only do we have a tool, frankly, it would apply to you. If it does apply, your life will get better in multiple measures, including, by the way, your risk of morbidity and mortality from COVID.
Yeah, thanks for that, Dr. Cassidy, Senator Cassidy. I think, as we think about this issue, there are so many of us that actually have been to our healthcare provider and said, we want to do something about our obesity, but there are these barriers that are put in front of us. And obviously that's one of the key things that the Treat and Reduce Obesity Act will do, is make sure people can get counseled the right way and make sure they have access to the latest treatments. So my last question for you is kind of about the politics of this. So, politics and policymakers, and that can be very divisive, right? But TROA has been pretty bipartisan, and we know obesity, whether you're a Republican, a Democrat, or an independent, it affects all of us, right? I mean, there's studies that actually show it affects us all equally. And actually, we all have the same consequences for that. So what needs to happen to continue this bipartisanship around TROA and really push it across the finish line?
I think what has to happen, we live in a representative democracy. I am hired to represent. When people are calling me and talking, tugging on my lapel at church, or stopping me in the grocery store and mentioning something, that elevates it in importance. It's my job to represent. So one, I would say anyone who cares about the issue, of course everybody watching this, should reach out to their elected representative, their senator, and ask them to consider this legislation. Secondly, we just have to be strategic. If there is now this is a Medicare bill, a little bit of process. It has to be attached to a piece of legislation which addresses Medicare or something related to Medicare. But we have to look upon this and bill it as the policy to address the very public understanding, publicity, to get passed, knowing that if we address the good policy with the publicity, that maybe we can overcome the politics. There is nothing partisan about lowering a death rate from COVID. So we need to hit that sweet spot. And I would argue that we need folks watching this video to contact the folks who represent them, as well as we working on the inside to try and bring it to completion, that this can pass. And I do think COVID gives us that opportunity.
Thank you, sir. We very much appreciate you being here today, taking time out of your busy schedule. I'll give you one last instant. Anything else you want to share with our members and people who are supporting Obesity Care Week this week?
Yeah, so the true compassion is to not only tell folks that, listen, there's an issue that you must address, but working hard to bring them the tools by which they can address. And if we can combine that, then we, everybody involved in this, can say we are being truly compassionate. Do unto others as you would have them do unto you. This is something we can do for another, as we hope someone will do something similar for us. Let's do it.
Thank you, sir. We very much appreciate it. Thanks for taking time today. And again, we truly appreciate this. I know your team has been wonderful to work with, and my kudos to them for all these years supporting us and trying to move this legislation forward. Thanks again for being here today.
Thank you.
As you can see, Senator Cassidy truly echoes the passion of all of us in fighting for the passage of the Treat and Reduce Obesity Act. And most importantly, we encourage you to listen to his words and contact your legislators today and encourage them to support TROA. Up next, we had the opportunity to speak with Congressman Dr. Raul Ruiz. Dr. Ruiz was elected to the U.S. House of Representatives in 2012. He represents California's 36th district and serves as the chair of the Congressional Hispanic Caucus. And lastly, he is the primary Democrat co-sponsor of the Treat and Reduce Obesity Act. Let's take a look at the Congressman's interview now. Congressman Ruiz, we spoke with Senator Cassidy regarding the length of time it's taken for us to move the Treat and Reduce Obesity Act across the finish line. For those of our members and constituents who are growing impatient and frustrated, what do you think it's going to take to pass the Treat and Reduce Obesity Act?
We need to make sure that we address what the American people are really concerned about right now. And that's two things. One is we need to get over this pandemic and save lives. And two is we need to reduce costs. And the reason why TROA is so important to address the urgency of now is because we know that obesity puts individuals at higher risk of complications and death from COVID-19. So in order to save lives, we need to address the obesity epidemic. And the second thing is that TROA will help us reduce costs. Currently, $1,900 a month is what the average individual is paying due to obesity. I think we can reduce those costs. We will add access to medications that will help individuals reduce their obesity in the Medicare program.
Yeah, thanks for that, Congressman. And you mentioned COVID. So, when we think about obesity, we've kind of been able to avoid this topic for decades now, right? We've been able to just kick the can down the road and say, we'll deal with obesity at some other time as a country. But COVID changed that, right? For the first time, we had, people who had obesity had a condition that could harm them today, not tomorrow, because when you combine obesity and COVID together, obviously there's this opportunity for really adverse outcomes. What are your thoughts on how COVID has changed some of our conversations around obesity?
Well, it was very clear from the beginning that the coronavirus affected certain individuals way more than others. And the first was age. And we knew that the elderly population were more likely to die from the coronavirus than younger populations. Then we started realizing that those with chronic illnesses, the hypertensions, the diabetes, and then part of that was obesity, which obesity is often associated and is a risk to then develop hypertension, diabetes, and all the other chronic illnesses that the coronavirus was causing a higher morbidity and mortality in those different illnesses. So I think that we all woke up to the realization that America is unhealthy compared to other industrialized countries. That's why our death rates are so high and why we need to address the overall health of America. And obesity is an epidemic. We have about nearly half of the population suffers from obesity, and that's about 42%, of our population. It is rampant in our youth and our children. We have metabolic syndromes that we need to address, and so therefore, in order for us to be better prepared for this and other pandemics, in order for us to reduce healthcare costs in general, in order for us to reduce the rates of diabetes and hypertension and other illnesses that can then lead to other morbidities, then addressing obesity now in our country is a smart investment for the health of our population.
Thanks, Congressman. I couldn't have said that better. That's why we need to get the Treat and Reduce Obesity Act across the finish line. So one final question for you, and it's about how Congress works and how these activities are moving forward. So one of the things we've noticed with the Treat and Reduce Obesity Act is it's widely bipartisan, right? And it seems like, at least to the American public, right, that we don't see a lot of bipartisan activities anymore. We see very divisive nature. So what do you have to say to our members about the importance that this legislation can continue to be bipartisan as we move to seek its passage?
Talk about patients. I'm an emergency medicine doctor. When a patient comes in, we never ask, are they Democratic or are they Republican? We just see a patient and we want to do the best to help them at that specific moment. And if we can keep the story based on the patient, based on the people, and tell the stories of how obesity is rampant and how it has affected individuals' lives, then I believe that it'll help remove the notion that that everything has to be partisan. Right. And so if we can come up with good solutions, which we have, the TROA Act is a good solution that will catapult us to the next step in allowing for a comprehensive approach that scientifically has been proven to work better. In other words, using medication with behavioral therapy in helping our seniors. I think that we will be able to take a more bipartisan approach, which this already has, and then start to work within the committee's structures, especially the Ways and Means Committee, which has jurisdiction over Medicare, and of course the Energy and Commerce, which has a jurisdiction over healthcare that's not on Medicare. Then I believe that we can make a very strong argument to get a hearing and to move this piece of legislation out of committee and onto the House floor, and likewise in the Senate, so that we can put this piece of legislation on the president's desk.
Thank you, Congressman Ruiz. We very much appreciate your support of the Treat and Reduce Obesity Act. Appreciate you being with us this week here during Obesity Care Week. Thank you so very much.
Thank you.
Once again, I'd like to thank Senator Cassidy and Congressman Ruiz for joining me for this discussion on the Treat and Reduce Obesity Act. We greatly appreciate their time. This is an extremely important week as it's Obesity Care Week, and we are on Capitol Hill representing the millions of individuals affected by obesity, advocating for the Treat and Reduce Obesity Act. But we need your help too. Please visit obesitycareweek.org/2022 and take action on TROA today. Before we close today, we'd like to once again thank all of our supporting champions. And we would like to thank our partners, our bronze partner, Eli Lilly, our patron partner, EndoPharma, and our supporting partners, Boehringer Ingelheim, Celebrate Nutritional Supplements, Curax Pharmaceuticals, Fujifilm, Intuitive Surgical, and Rhythm Pharmaceuticals. Remember, now is the time to act. Thank you very much.